Hello and welcome to the House of Wellness. I'm Jo Stanley alongside Luke Darcy, Jacqui Felgate and Dr Nick Carr. Hi there, guys.
Hi.
Joe.
A special shout out to you if you are partaking in Dry July, giving up the booze for the month of July in support of those affected by cancer. Keep going. You're almost halfway there.
It is also plastic-free July, Joe. But you know what? I don't feel like we need a month to be plastic-free. We should always be thinking about caring for our oceans, making our oceans, streets and neighbourhoods plastic-free, don't you think?
And Jack, we're thinking all the time at home about food composting, green waste, single-use plastics. As a kid growing up, I don't think I'd even heard of those terms or certainly didn't understand them. So I feel like we've come a long way on that front.
Well, what's been targeted around the world right now are microplastics, those tiny little plastic particles that are found everywhere, even in what we consume.
Yeah, and of major concern to me, Jo, is that a recent study of microplastics in human placentas found their presence in every single one tested. Now, we still don't really know what the health effects of that are, but you've got to think that reducing our use of plastics is absolutely vital.
Well, we all need to strive for a healthier planet, and we also need to support new mums and bubs, and that is very much the focus of today.
In everything from bump to birth and beyond, starting with the recent Baby Expo.
Melbourne researchers are on the path to improve the heart health of pregnant women with preeclampsia. We find out how today.
And the patients of GPs who show empathy have better outcomes. I mean, who would have thought it?
Well, you know, an astonishing 140 million babies are born around the world every year, which is 4 new lives every second, every day.
And every single baby is a miracle, right from the moment they're conceived to the moment that they're born. I've been seeing babies for over 40 years, and they never cease to amaze me. Right from the start, one tiny egg, one brave little sperm. Within weeks, cells that started off looking the same begin to differentiate into kidneys, liver, brain, everything needed to make a whole human being. Human embryos, like the embryos of all mammals, start off female. And if there's no Y chromosome present, then they stay female. If there is a Y chromosome present, then around about 9 or 10 weeks, boy characteristics start to develop. Incredible! In the womb, babies' lungs are full of amniotic fluid, and they strengthen their respiratory muscles by moving this fluid in and out of the lungs. They also swallow some of it, which is then processed by their growing kidneys so that your baby is actually weeing while in the womb. During labour, chemicals secreted by the baby start to clear fluid from the lungs. Squeezing through the birth canal releases some of the rest, and that first breath expels the last. Lungs that have been full of fluid for 9 months are now full of air, which is used for that first welcome, lusty cry of the healthy newborn. A baby's head is big and round, which would be really hard to get through the birth canal. But nature has a solution. The skull bones are not joined together, which means under the pressure of birth, they slip over one another, making the head longer and narrower. Then, soon after birth, that rather weird cone-shaped head remodels and becomes that lovely, healthy, round baby shape. There are so many extraordinary facts about our littlest humans, but I'll leave you with 2 last examples. First, newborns don't see colour. They're born seeing the world in grayscale and only develop colour vision in the first few months. Second, all newborns have what's called an innate swimming reflex, which means that underwater they naturally hold their breath, slow their heart rate down and open their eyes, which means we're all born as budding water babies. Babies really are amazing. So next time you see one, spare a thought to all the miraculous things they've been through just to get safely into this world.
Well, Jack, anyone who has been to a birth has serious respect for women. I've been to 4, and Beck is a superstar, and the pain threshold of women, all of you mums, are just literally incredible.
It's true. It's true. I must say, from my pregnancies, I was just obsessed with my midwife. You really need that support person there who cares for you and shows empathy.
Well, the same goes for visits to the doctor as well, Jack. There's a link between GP empathy and better outcomes for patients with chronic pain.
This is really interesting, Das. They compared people with lower back pain who went to 2 different physicians. One, that showed empathy and one that didn't. Can you guess the outcome?
I'm going with the empathy there, Jack. I think it's true in life, isn't it? People that show you empathy, you generally have a better rapport with. Not surprising, you're going to feel better and have better health outcomes.
I was so lucky to be surrounded by people during my pregnancies who showed a lot of empathy, that were really kind. But I think the most important thing is whatever your pain and whatever you're going through, to show that they care for you and that what you're going through is actually normal.
It's a stressful time, isn't it? Especially first time around. I got more
100%.
stressed the more kids we had. Jack, Beck kept saying, it's not about you. This time it's like, well, I'm getting stressed.
It's not about you, that's right. Well, one of the things that's quite common in pregnancy is preeclampsia. It can be linked to high blood pressure as well as a whole range of other issues. And now it's also been linked to another health concern.
I first became aware that something was wrong during my pregnancy when I noticed I had all of this swelling. So on my hands particularly, I couldn't get my rings on my hands. My feet started swelling, and then I noticed in my actual face that I kind of started to feel and look like a bit of a different person.
At 36 weeks pregnant, Amelia Thompson was diagnosed with preeclampsia.
So preeclampsia is where you get high blood pressure in pregnancy and multi-organ dysfunction. And we think the cause of it is probably from the placenta. So there's still research into it because we're not exactly certain what it is.
Dr. Sue Wei Lee treats women with what can potentially be a life-threatening condition, elevated blood pressure that affects the mother and unborn baby.
As obstetricians, we get quite freaked out about preeclampsia because if you think about the name of preeclampsia, it's pre-eclampsia. And eclampsia is where a patient can go on to have fits, and fitting, of course, can be catastrophic.
Preeclampsia can have a myriad of effects, from kidney dysfunction and swelling of hands, feet and face to headaches and vision issues. But the first red flag is high blood pressure.
Then the next thing we find is there's often protein in the urine because their kidneys become leaky. The liver function then goes off. And in the worst case, your platelets also become really low.
As soon as we found out that I had it, we basically booked in for a cesarean for the next day. So it was very quick. So there was no treatment. It was, let's get him out as soon as possible.
If the cause of preeclampsia is from the placenta, then essentially the only definitive treatment is to deliver the placenta. But we can't deliver the placenta without delivering the baby. So it depends very much on what gestation we diagnose it. We kind of then have to weigh up that balance between, do we deliver a preterm baby against the risk of the disease to the mother? So we then treat the blood pressure and then see what else we can do. So it's a fine line that we walk there.
It was thought that once the baby was delivered, the risk to the mother was over. However, new research has proved otherwise.
And we'll check your blood pressure, if that's okay.
Yeah. So we see women at 3 months after they've had a baby. And historically, we used to think your blood pressure comes back down to normal. But when we then also look at the other cardiovascular risk factors, so high cholesterol and diabetes, we're actually finding more women with undiagnosed high cholesterol and other risk factors. So that's been a surprise, both to us and to the patients, because, these are patients that are generally young and fit, and they think, I'm healthy. I've done all the right things. I'm not particularly overweight, and you look at it and go, how did it get there?
The link between preeclampsia and heart disease forms the basis of the Enrich Me study set up by Dr. Lee, where women have their cardiovascular risk assessed after their baby is born.
We really want to raise awareness that preeclampsia and a pregnancy complication increases your long-term risk of getting cardiovascular disease. And this study will give us some tools and give the patient some tools as to how you manage your risk, how you reduce the risk, and keep you healthy for longer.
Winter is football and netball season, which also sees a rise in kids' head injuries. Coming up, we get the expert advice on how to recognise concussion, and Zoe showcases the best of the 2024 Baby Expo. That's after this.
know about you, Jack, but I found getting back to the old me after I had my daughter Willow really hard. And I think these days the pressure to bounce back for new mums is even more, to be quicker.
Couldn't agree with you more. And I think a lot of it comes down to social media, whether it be the judgment about breastfeeding, about your weight, about your body. So much more pressure than what we had.
Absolutely, which is why I love this study. It is a global study and it's looked into the best ways to combat post-baby blues. And it turns out excessive exercise and striving for a pre-baby body, it's not it. Actually, it's better to focus on what your body can and did do rather than the way it looks.
And not about what your body used to be, rather, as you say, what your body can do, and the most remarkable thing, carrying a child, isn't it?
Amazing. And it's really important to have really beautiful me time to do something that is just for you. But it's got me thinking about, you know, the gadget that I could not have lived without when I first had our baby. It was that beautiful front body carrier where you have your baby on your front there. You got hands-free, you can go to the market, go to the footy, you know, you got that warm little baby on your front. It was the best.
Yes, I agree. I have one of those as well. Although times have changed, even from when I had my kids 8 years ago. We didn't even have a baby monitor. There was no screen. It was just kind of listen out, had a little thing that you could hear sounds. That was it.
Oh, look, I'm sure that there are millions of gadgets that we hadn't even thought of when we had our children, some of which Zoe recently discovered at the latest Baby Expo in Sydney.
It's been 10 years since I last had to navigate a push-up. And let me tell you, things have changed. These days, you get to road test before you buy. The baby days are long gone for me, but for the many expecting parents, this is nirvana. Everything from birthing demos and how to wrap up your new baby to ways to safely transport them and even feed them.
We all needed to use formula at different points in our feeding journey, and what we wanted to use, we just couldn't find on the market, so we developed it.
Charlotte Chambers is one of 3 co-founders of Mamamoo Baby Formula.
When it comes to the beginning, how do you actually go into that world of developing baby formula?
Well, we're mums, we're not scientists or nutritionists, so we worked with leading infant formula researchers to make sure that we were developing a really high-quality premium product that uses 100% Australian grass-fed cow's milk.
So for a lot of people out there, the journey of breastfeeding isn't an option, or they choose not to breastfeed. What would you give advice to when it comes to struggling mothers?
We are incredibly supportive of those breastfeeding mums, but we also know sometimes that doesn't work out for so many different reasons.
No one understands that more than Vanessa Salerno, a modern-day doula who's helped hundreds of women through their pregnancies, into the birthing suite, and then at home with their new baby.
The term, actually, doula means, it's a Greek word that means to serve a woman. As a midwife, it's with woman, and we're there to serve a woman during birth and postpartum.
This must be such a rewarding career, and I guess sometimes also quite overwhelming as well. Tell me a bit about that.
You come along as their doula, but at the end, you almost become a friend or part of the family because you carry that emotional support during pregnancy, and it's something that I honestly cherish, especially if they've also been on a big journey to fall pregnant as well. So I do a lot of fertility support, and coming the other end, it's beautiful to watch.
Support every step of the way is so important for first-time parents, as is getting the body back into familiar working order after pregnancy, which can be done with a few tricks of the trade.
Stratamark is a topical gel that sits on the skin, and it is clinically proven to prevent and treat stretch marks. So how it works is it forms a protective barrier on the skin, and that is what normalises collagen production, and that's what prevents the stretch mark from occurring.
And how does it differ from other products on the market?
Well, Stratamark is actually a medical product. It's not a cosmetic product. It doesn't actually get absorbed into the skin, so it's suitable for use during pregnancy, breastfeeding, and for people with sensitive skin.
Tell me some of the feedback that you've had.
I guess the best feedback we can ask for is clinical data. 88% of women reported a reduction in redness and discoloration, and 86% of women reported a reduction in visibility of stretch marks. So great feedback all round. It's also a really easy product to use. It's just a once-a-day treatment.
That's mum's skin taken care of, but what about baby's skin? I'm talking about pure and practical clothing. Something that pushed Nikki Verrocchi to design her own range of baby clothes.
The Bambi Mini journey started back in 2020 when I had two little ones. I guess I was in the search of a really good, soft, organic baby wriggle suit, as we call them, at an affordable price.
Midway through setting up Bambi Mini, the family were hit with devastating news. Their little boy, 2-year-old Rafi, was diagnosed with leukemia.
Life took a bit of a step back, right, and just concentrated on Rafi at the time and just on his health and getting him better. So we spent quite a few months in the hospital, and yeah, we've been there ever since.
So you have a strong affinity to the Royal Children's Hospital. Tell me how that's their support that they've given you.
The support that they have provided us and Rafi is just beyond. It's just been incredible. They've saved his life. And, you know, it was a couple of hard months of treatment, which led into a year, which led into 2 years, and then Rafi was finally cancer-free at the end of that. And so I think we just want to give back to the hospital that gave us so much.
Which is where Bambi Mini Kids Socks come in. Nikki's initiative was all about raising funds for the hospital that nursed young Rafi back to health.
So you've told me all about the Baby Mini Kids Socks, but what about us big kids? What about us?
Well, yeah, I guess that could be the next line extension. Like we will start preparing for Good Friday appeal in a couple of months' time. So I'm definitely going to look at putting that into the plan for 2025.
Perfect.
Yeah.
With so much on offer, there's no need to go it alone during or after the most exciting phase of your life. But for me, one of the most important items is the one where you can kick back and relax with your new bub.
High five. Yeah. All right.
Well, Nick, always been a massive advocate for getting outdoors, playing sport and the huge amount of benefits that come with it. But as you know, injuries is always going to be a byproduct of doing that as well.
Yeah, and outdoor team sports, things like soccer, football, netball, that's where most of the injuries occur. And they're things like strains, sprains, fractures. They're probably the most common. But, you know, funny enough, the sport that's most likely to land you in hospital is cycling, as I know only too well.
Yeah, some risks attached to that one, Nick. Statistically, you're more likely to get injured at training than in a game, particularly for kids that are trying a new sport.
Yeah, and some tips for parents to help keep their kids safe. Make sure your child warms up properly, that they know the rules of the game. That's kind of important. And finally, that they're wearing all the right protective equipment or gear.
Nick, there's a lot of interest in concussion-related injuries and head knocks, particularly for our kids in contact sport. Here's Dr. Oak Teague from the Royal Children's Hospital.
Since time began, children have been running around and crashing into each other and enjoying play and sports. It's only more recently that we've started to think through some of the implications of the kind of injuries that children can sustain. Concussion, this serious matter, is actually surprisingly and a bit disturbingly common. 1 in 5 children reach their 16th birthday having had a concussion injury during their lifetime. If we don't look after a child effectively, that prolongs the duration of their symptoms. So something which might normally resolve within 2 weeks might take many more weeks, even months. And over that time, this is a child that can't re-engage with life as they ought. They're not able to attend during school time. They're not able to get their homework done. They're suffering from headaches. Perhaps their development is slowing down for some of the younger kids, but also for the older kids as well. For all the children in Australia that currently do get a concussion injury, only 1 in 5 of those is being brought to be assessed by a doctor. In fact, 1 in 5 of those children is also doing something quite dangerous, and that's being allowed to return immediately, for example, to the field of play or to carry on with their other activities. And those children are now at increased risk of a second and more significant concussion. Many parents feel ill-equipped to know whether their child, 1, has a concussion, and 2, how severe that concussion is. And that is exactly at the heart of an app which has been developed by the Murdoch Children's Research Institute. It's called Head Check, and it's actually a really helpful, pragmatic way. It runs carers and parents through very simple questions about specifically their child in front of them, and then we'll give them a recommendation. The recommendation might be that everything is okay. The recommendation might be, actually, your child sounds like they have a severe concussion. You should be calling an ambulance and getting that child to a hospital. What does help after a concussion is a good 2 days of rest. During that time, we're not closing children off from all activity and all light and all stimulation. What we're saying is, let's do some light exercise. Let's reduce the stimulation on our brain so that's less screen time and less homework. And after that, 2 days of rest and recovery, we're going to have a graded return to school activities, screen time, a graded return to homework. But the one thing we're not going to return to until we've completely recovered, typically 2 weeks, is the field of play. It's really important in all of these discussions that we not lose sight of how positive sport is for Australian children, how positive fun and activities are, even those which could involve a bump to the head. It's good that we have a sense of what is proportionate, what is appropriate, and we do protect our children from bumps to the head. But we can't shut them off from all activity and possibility. And I would encourage all of our families to listen to a message like this and respond by thinking, how could I recognise a concussion in my child, rather than, oh, that's the last time they're ever playing this or that sport.
Up next, model businesswoman Brooke Pitt swaps beauty hacks with Jade Kay and shares her memorable pathway to motherhood. And Abby Holmes does her best to catch up with Australia's fastest woman, the incredible Tori Lewis. Back after this.
Now, Darcy, I know you love your sleep. You're an A1 sleeper, but how do you go dreaming?
Well, I don't have a lot of recollection about it, Jack. I feel like I get in those deep sleeps. Just some fleeting memories, but certainly nothing concrete.
I'm not surprised about you. Well, you know how animals can dream. I know our dog, Harry, his little legs go while he's sleeping, but it's really interesting. Animals can have really complex dreams and recall actual events.
Yeah, the latest info coming out of the US, researchers are now understanding for the first time what animals actually dream about, and it turns out animal dreams are linked to actual experiences in their life.
So interesting. It's long been thought that only certain animals can have that kind of in-depth dreaming, examples chimpanzees and dolphins, but now we've learnt that they can recall actual events that have happened to them.
Well, Jack, a lot of athletes around the globe are dreaming about winning Olympic gold medals in Paris, including Aussie sprinter Tori Lewis, and she caught up with Abby Holmes in Adelaide on the road to Paris.
So Lewis is 2 from the left. Mafoko outside of her, and Day's right in the middle. And Day's had a pretty good start here, and so is Lewis, running a really good bend. So the fastest woman ever at 100, and Day puts it to Lewis on the turn. Lewis,
born in the UK, moved over to Australia at the age of 6. When was it that the athletics bug bit?
Really, when I was 12, I had just quit gymnastics, was looking for a way to stay fit, went down to my little athletics, and then it was just kind of really good. And then a year maybe later, my coach found me and just started running with him.
Carla Ball coming through pretty strongly, but Tori Lewis careering away now. It's a good pipe opener for her. In fact, it's inside 23, which will be the first time I reckon she's ever done that.
And it's an interesting story. You were a very good gymnast. You were undiagnosed with celiac disease, and that was ultimately why you stepped away from gymnastics.
Yeah, so I was training 20 hours a week with gymnastics, and then all of a sudden I just went through this really rough patch where I was just struggling to get out of bed and get to training, and like that went on for months, and I just thought my body's just not dealing with this anymore. So yeah, I quit gymnastics, and then a couple months, maybe 6 months after that, I got diagnosed with celiac disease, and then they were like, yeah, that's why you couldn't do anything, because you were so sick.
How did you navigate that once you were diagnosed? Did you have to change much to really, I guess, allow your body to respond and recover and still be able to perform at high levels?
Yeah, so I had to change fully my diet to totally gluten-free. I had to get an iron infusion because I think my iron was at like 2 or 3. And then it took it took a good 6 months to get back to kind of where I had the energy to want to go out and do stuff.
So jumping the best, that was Ebony Lane, and now it's Tori Lewis trying to fight up, and Ebony Lane, Tori Lewis is now starting to pick up. Brie Masters will go with her, and so will Mia Gross, but Lewis, her lane.
It wasn't that long ago, the 100-metre Australian record. The moment of crossing the finish line, seeing that time, Yeah. What was running through your mind? I mean, crossing the finish line, I was just glad that I won, you know, kind of a season opener-ish for me, running against the girls, and I knew it was good because usually we're all kind of in a line, but I could see I was a bit in front, and then, yeah, I heard the announcer say the time, and it was pretty surreal.
And it's 11:10. The Olympic standard, ladies and gentlemen, is 11:07, but she has just put herself right in the mix, Tori Lewis.
Training competition takes up a lot of time, physically and mentally, but you are also a little genius, an ATAR of 95.2. Talk to us about the goals that you have with your studies and how you best juggle that. Yeah, so I didn't really know what I wanted to do, and I had a gap year, and I came back. This is my first year starting university now, studying software engineering. So yeah, just tech, you can do anything with it, and it's in the future and you can do it all online, so it really helps when I'm overseas. I can, as long as I have laptop and Wi-Fi, I'm good to go.
Into the straight. Let's see what gap Tori's got. A little one. Gross and Day are up with her for the moment. She looks powerful though, Lewis, coming away.
I'm assuming that the Olympics are your #1 goal over many years to come. What kind of heights do you set for yourself? Because we're looking at you thinking, you know, you're 19 years old, you're just in the infancy of your career. It's so exciting in terms of what you can achieve. Yeah, I mean, I want to be an Olympic finalist. I want to be an Olympic medalist one day. Obviously, probably not going to happen this year. So I guess it's all about stepping stones and getting the experience I need to be able to do that one day. And obviously with the relay team, I think we can make a final. So that would be amazing if that happens. And then, yeah, hopefully I'll be able to represent an individual this year.
Wasn't that long ago, you're just one of these juniors walking around here looking up to the stars. They're now all looking up to you.
Yeah, I mean, last year I had kind of no one except for my mum and coach cheering for me to now have so many people. It's pretty cool.
The inner workings of our bodies are fascinating, Sarah. Take the gut, for example. Right here, there is a diverse community of bacteria, viruses and fungi, all living together in the gut microbiome, while we're just getting on with our life.
And Luke, life is certainly easier when this gut microbiome is in balance, as it provides the foundations of adults and children's everyday health and well-being.
With 70% of the immune system found in the gut, a healthy microbiome also has an influence on our immune health. Lifestyle factors can help in maintaining a healthy microbiome and immune system health.
Eating vegetables, cutting out sugar, regular exercise and getting enough sleep all contribute to a healthy microbiome. You may also look to introduce probiotics.
These are a type of live, beneficial bacteria that have shown to support immune health.
LifeSpace, Australia's #1 probiotic brand, are specialists when it comes to understanding the gut microbiome and its relationship with our immune system.
The immune health range includes the Children's Immune Support Probiotic that relieves common cold symptoms with the power of multi-strain probiotics. It supports the immune system with added vitamin D and zinc, as well as elderflower.
And for adults, there's the Immune Support Probiotic, with 5 strains of beneficial bacteria combined with vitamin C and zinc. It relieves common cold symptoms and helps reduce the occurrence of symptoms of upper respiratory tract infection while supporting the immune system.
And if you're still having trouble picturing all the action happening inside the gut, take a look at one of Australia's other living ecosystems, the Great Barrier Reef.
An Australian icon, and it too utilises probiotics which help support its health and well-being.
And just like your own gut, it is essential we do what we can to look after it.
Thanks to Heinzie and Sarah Davidson there. Well, today is all about pregnancy, birth, new parents and everything that comes with that. And I have to say, Jack, I remember when I was pregnant, the best thing was that I had the most incredible hair. It was thick and shiny, unlike when I'm not pregnant.
That did not happen to me, and I am very jealous. But it is due to an increase in pregnancy hormones and estrogen. And conversely, once you have your baby, A lot of that hair actually falls out.
Yeah, that did happen. Yeah,
Also happened to me.
Yes. Well, female hair loss can be due to a variety of reasons: stress, ageing, not having the right kind of hair care. And one kind of alopecia happens because the immune system attacks the hair follicles. And for this, US researchers believe they have made a huge breakthrough.
You're so right. They've invented a microneedle patch that goes directly on the scalp, and it actually encourages cells to stop attacking hair follicles.
Yeah, the treatment is unique because, unlike other treatments, it works with the immune system rather than against it. Amazing.
Well, a lot of our self-confidence comes from the way we look, and model mum and businesswoman Brooke Pitt opened up to Jade Kay about her journey to motherhood during a well-deserved makeover.
Brooke, you've achieved so much over so many different fields, from business to modelling to presenting and more recently, mum. Congratulations. Over these different ventures, how has your approach to beauty evolved?
I would say that my approach is the same, it's just my appreciation that's changed. So over my years of modelling, I was always front-facing, getting my hair and makeup done all the time. And nowadays, with an 11-month-old, I just don't have time to do anything like that. So I just really appreciate those times when I do get a minute to sit in front of the mirror and, you know, do some nice makeup or do my skincare. I just really appreciate that time that I get for myself, and it's a bit of self-care.
You've been incredibly brave with sharing your story about IVF with the birth of baby Billy. Tell me, what made you share that?
Yeah, so it actually was a really big decision for Miles and I, my husband and I, to talk about our IVF journey. I think I'm quite a private person, so it was pretty confronting. It's obviously such a personal thing to go through. But when we were going through it, I found so much hope and positivity from talking to other women that have been through it. So I think once we had gone through that journey and thankfully got to the other side, and obviously now we've got little Billy here, I knew how many other women needed to hear positive stories. And I just knew that with, you know, my reach on social media and what a privilege that is, I really wanted to be able to use what we had been through to help other women.
You're a big fan of Pilates. How has this contributed to your overall well-being?
So I've always loved Pilates over my years of modelling and kind of, you know, always having to sort of focus on my figure. It was just a form of exercise that I loved, that I really felt good about doing.
Being in modelling for such a long time, you've been exposed to a lot of professional makeup artists. What is something that you have learnt, and what's something you'd like a little more help with?
I've learned so much, and I think you'll know this. Whenever I have my makeup done, I always have one eye open, trying to like learn and see what everyone's doing because I enjoy it so much. But I think for me, what I've learned from makeup artists is how important skin prep is. And I just find whenever I focus on doing things like that, my makeup always sits so much nicer. But I'd love to learn how I can really quickly make myself look alive. I don't have any time these days, so something that I can slap on my face so I can walk out the door and look refreshed and energised without taking up too much time.
Brooke, I think if there's one product that you would take to a deserted island or just even around here near the beach, it would be bronzer. And this one is great because it's natural, but it also works really well if you don't want to wear any foundation. So I normally use it around the cheekbone, around the halo of the head, across the nose if you'd like, and then just around the jawline and all the way down the neck. So your career started at the young age of 15. Tell me, Brooke, what's some advice you'd give your younger self?
When I was younger and at school, I really hated my freckles. I didn't like my beauty spots. And it was something throughout my high school years that I got teased about, and it was something I was really self-conscious about. So naturally, it's what you sort of try and sort of hide, and it's what you don't like about yourself. But as I've gotten older, I've realised that's what makes me unique and what makes me me, and it's what I appreciate most about myself is, you know, things that are different to others. So I'd go back and I'd just say, love like your skin the way it is, and as you get older, these things that you maybe don't like now, you'll find such an appreciation for.
There's acute sinusitis, which is primarily an infective thing, and then there's people who suffer from chronic sinus inflammation. Acute sinusitis is mainly an infective phenomenon. Patients will often have pain and pressure on their face on one side only. Often that pain radiates down to the teeth or into the back of the eye, and they'll be very blocked and congested on one side and sometimes even have a bad smell in their nose. If that's an acute event and it's only on one side, then that is very suggestive that someone's got a bacterial cause. And chronic sinus disease is not an infective phenomenon for most people. It's an inflammatory disorder, a little bit like asthma and other airway disorders. Most people, when they get symptoms, they are bilateral and they're really part of a rhinitis reaction. A rhinitis reaction means you've just got an inflammation of your nasal passage. They can get very blocked, very congested. They can often feel tissues and tissues worth of mucus and secretion. And if you do a scan of someone during that acute rhinitis event, they often have completely normal sinuses. Rhinitis is thought to affect 20 to 30% of the Australian community, with about a couple of million presenting with sort of active symptoms all the time. When patients have lingering mucus and other symptoms, we get them on really simple treatments like nasal saline irrigations, where they're using a saline irrigation to wash out the mucus production from their nose. This often makes people feel like they're clearer, they're easy to breathe, and helps to, help them recover from their symptoms a bit quicker. Nasal irrigation has been around for many centuries in different cultures and societies around the world. Some people really become converts of nasal irrigation. They've gone away from perhaps erroneously relying on antibiotics to manage mucus symptoms that come about during winter to really just managing them with nasal irrigation.
Well, Joe, I think it goes without saying, all of us want to live long, healthy and happy lives with an emphasis on the healthy and happy for mine.
Absolutely. And, more people are living to 100 than ever before, and they've found some specific biomarkers in people who are living much longer lives.
Yeah, there's a long-running study, Joe, that shows that high levels of glucose and uric acid, which are a byproduct of the waste from the kidneys, are a determination that you're less likely to live to 100. So once again, it comes back to healthy eating and diet.
Absolutely. But there are some other factors at play in living a long life, all of which are absolutely my jam, Das. Acceptance, having the grit to overcome adversity, having a positive attitude, having a purpose in life. And once again, it's that connection, the close ties to family and land.
Yes, Joe, that connection to land and nature is high on Zoe's list. She's all about perfect, healthy ingredients that look fantastic on the plate.
Travel not only broadens our horizons, but also our taste buds. And my farro tabbouleh with strawberries and goat's cheese is the ultimate souvenir from our friends in the Middle East. Start with the farro. I love this ancient grain for its nutty flavour and chewy texture. Bring it to the boil and let it simmer for about 30 minutes while I get on to the salad. The star is parsley and lots of it. And I'm finally chopping everything. Mint is a tangy pairing for the parsley, while spring onions and cherry tomatoes add softer, sweeter flavours. And my own twist, strawberries, delivering freshness, colour and a boost of vitamin C. There's a lot of intense flavours happening in this bowl, so I'm balancing it out with the earthiness of goat's cheese. You can also use feta if you're up for a salty, sour contrast. Lucky last, pine nuts, introducing a new texture, crunch. The cooked farro brings heartiness and bulk to the dish, making it the perfect side salad or solo meal. Dressing is optional, but the citrus holds up so well with the salad, so give it time to marinate before digging in. There's a lot to love about tabbouleh. It's pungent, fragrant, invigorating, and you don't even notice there's no meat. This is not just a salad, it's an excitement for the senses. Get Nourished is brought to you by Vitamin C Lipo Sachets. Liposomal vitamin C provides up to 80% higher absorption than standard vitamin C. Put your vitamins to work with Lipo Sachets, Australia's #1 liposomal vitamin brand.
Well, earlier today we were talking about the importance of new mums and dads to carve out that precious me time as much as possible after the baby is born. Well, how's this for taking chilling out to the next level? It's the annual Space Out competition, which for one day a year turns chilling out into a competitive sport.
And I absolutely love this one, Joe, because it's held in cities around South Korea, and it's really quite a sight, because the idea is to be as zen as possible for 90 minutes. And the staff go around and take the competitors' pulses, and the winner is the one whose pulse is most stable.
I love this. The only rule is, though, you can't fall asleep, otherwise you'll be disqualified.
I think, Jack, I would genuinely fall asleep the
I'm not
moment that
surprised.
competition started. I'd want to win, by the way. But don't it sounds a bit like the Squid Game of mindfulness, that one?
Yeah, Squid Game, fantastic series, bit scary. But the brain behind this South Korea competition was a local visual artist. And the idea was to highlight the difference between the urban, busy lives and those of the idle participants.
That's right, and to break down the misconception that to chill out and space out and do nothing is a waste of time. I couldn't agree more.
Well, it's been nice chilling out with all of you again on the House of Wellness. Thanks to Dr. Nick Carr, Jacqui Felgate and Joe Stanley.
Check out the House of Wellness Radio every Sunday with Gerald Quigley and Luke Hines.
Thanks as always to our great friends at Chemist Warehouse. It's bye for now.